Okay, so picking up these bone conditions one by one. Right now, we get to talk about the Paget's disease of the bone. Paget's disease of the bone. Okay, so you can see how the Paget disease looks like, how the Paget disease could also present, how it could present. Okay, so in talking about this Paget disease, we talk about the causes, the symptoms, the diagnosis, and the possible treatment of Paget's disease. Okay, so that Paget disease of the bone is a chronic. That means what? It's something that must have been there for a very long time. Okay, so it's a chronic and it's a progressive disorder that disrupts the normal bone remodeling process. Okay, so as your bone is growing, as your bone is developing, it will now disrupt the normal development process. You get it? So it will lead to what? You having weak bones and misshapen bones, right? So what are the causes? Could be genetic, right? Where we are saying what? The family history plays a role, where you're asking the patient that is there anybody in their family that actually has this type of problem? And they're telling them that about two of their uncles, you just simply know that what? It's a family link stuff. Age. It is common in people over 40 years, especially those over 80 years. Okay. Geographical factors. It has a high prevalence in regions like what? United Kingdoms, Australia, New Zealand, Western Europe, and United States. Okay. Then it could be due to viral infections too. Okay. So some theories suggest that a viral cause can actually what? Um, cause this, but it has not been confirmed yet. Okay. So symptoms is there will be bone pain, of course. Bone like this should be paining you. All right. So there's localized pain and tenderness. There's bone deformities. You're having enlarged bones, bowing deformities. Okay. You can see this is bow leg. Okay. And there's also change in your bone shape. Okay. There is also joint pain. So there will be pains in the joints of the back, the hips, the knees, and the rest. Neurological symptoms, you'll be having hearing loss, facial pain, nerve compression if the skull is affected in this Paget's disease. Okay. Then for fractures, there's increased risk of fractures in the affected bones because the bones are no longer strong as they used to be. Okay. Then diagnosis, you might want to do some x-rays. So x-rays, bone scans, CT scan, MRIs, all of this can help to what? Visualize the bone changes. Okay. Then blood test. If you do a blood test, you see that there's elevated serum alkaline phosphatase levels. Okay. Then bone biopsy, which is rarely needed, but it can help you to now further confirm the condition. Okay. So treatments, you give biphosphonates to slow down the bone resorption. Pain management, where you're giving analgesics for what? Pain relief. Physical therapy is just to improve mobility and strength. Surgery, you're doing this in severe cases to correct deformities or stabilize the fracture. Okay, so that's it for what? The Paget's disease of the bone.